There are fears of an impending spike in deaths from COVID-19 in Victoria, with the virus spreading through aged care homes. The virus has also hit the state's prisons. 6 are in lockdown after a prison worker tested positive. Yesterday, we saw the Premier taking some cautious optimism from the fact that the number of new cases had not continued rising exponentially over the past few days. The numbers are still concerning though, and there were 3 more deaths yesterday. We're expecting an update this morning from Victorian authorities. We'll bring you that live. And the New South Wales Premier Gladys Berejiklian will hold her media conference this morning at 11 a.m. Australian Eastern Standard Time. So we might have to juggle those media conferences when they happen. We'll let you know closer to time how we're going to handle that. Reporter Elias Kluwer joins us now from Melbourne. Elias, g'day. So take us through the situation in aged care homes there now. A big jump in the number of cases at one place in particular.
Yeah, good morning, Joe. I'm standing outside St Basil's aged care home in Fawkner in Melbourne's north, where cases jumped from 13 to 51 in a single day. Federal health authorities are on the scene. We saw before staff members in full protective gear cleaning the facility. We expect that to go on for quite some time. There are grave concerns for the people inside, and across Victoria there are 41 aged care facilities now that are linked to coronavirus clusters. As a result, the Victorian government has now moved to restrict access even further at public aged care homes. Carers can now only access the premises for 1 hour each day, and staff members who, according to industry experts, say brought in a lot of this virus, will now be offered $1,500 to quarantine if they contract the virus or are a close contact of someone who contracted it.
And yeah, Elias, when this happened in Sydney, there was deep concern about Newmarch House. There was a number of people who died there, and families became really frustrated about a lack of communication from aged care homes. Has that become an issue in Victoria yet over the past couple of weeks that you've noticed or heard of?
Well, I have heard that many family members are worried about their family members inside, given that they're not allowed to see them. Access has been restricted significantly, particularly in those private aged care homes as well as public. Now, as you mentioned, there's been a number of deaths in this Victorian second wave already linked to the to aged care homes, and in particular 2 of the deaths recorded yesterday were tragically linked to aged care as well.
Yeah. Now, what can you tell us about the 6 prison lockdowns in Victoria?
Yeah, well, this has come about after a prison guard at the Ravenhall Correctional Facility in Melbourne's west tested positive to coronavirus. As a result, the Victorian Corrections Department has moved to close down 5 further prisons. They are Loddam, Fulham, Hopkins, Langi Kalkal and Barwon Prison in the state's southwest. Now, lockdown in a prison means that prisoners are not allowed in or out of their cells. Other prisoners will be placed in quarantine units. Now, Corrections has been worried for some time about an outbreak in these prisons. As a result, if you're sentenced to a period of imprisonment in Victoria, you need to quarantine for 14 days before you can enter the jail. Now, in the 6 facilities that are in full lockdown now, health authorities and correction staff are now trying to contact trace to determine who came into contact with this prison guard. So they say they're doing everything they can to prevent this outbreak, which they have been worried about from the beginning of this second wave.
And Elias, over the past several days, there's been continuing concern about what's happening in regional Victoria as well, because of course the lockdowns happened in Melbourne and the Mitchell Shire. But what's happening outside that area?
Yeah, well, there still are calls from local Shire mayors as well as MPs to increase restrictions in these regional areas. Now, if we take the Colac-Otway Shire, for example, there's now 27 active cases in this area. Now, per capita, that's higher than many other municipalities in the Melbourne region. Now, this started in Colac as a result of a meatworks cluster that's doubled yesterday. And it also then extended into a school. Now, numbers in Geelong have increased to 18, which again is a significant concern. The Premier Daniel Andrews has already advised people in these regional areas to wear masks, but at the moment, there's no indication that he'll increase the restrictions to these regional areas. Now, across on the other side of the state in East Gippsland, a woman has been fined $1,600 from Victoria Police after going on a day trip to East Gippsland, and we understand several stores have been closed as a result. She was awaiting her test results, her COVID-19 test results, and it came back positive. So disappointing to hear that, Joe.
Yeah, OK, Elias Clue reporting there from Melbourne. And a Melbourne security guard hired to work in quarantine hotels says she was hired over WhatsApp and given no training. In March, the Victorian government contracted private security operators to monitor hotel quarantine guests at the Stamford Plaza and Ridges on Swanston in Carlton. An inquiry was launched last month after genomic sequencing linked Melbourne's most recent coronavirus outbreak to breaches in the quarantine system. Shayla Shakshi, who was hired to work at the hotels, has told the 7:30 program on ABC TV that staff were hired via WhatsApp, that's the messaging service, and received no training in infection control.
So they're like, okay guys, you guys got to come in a team, bring your own mask from tomorrow, bring your own gloves, your own sanitizers, because we might run out because we have so many guards on site, this and that. That was the first shift I did, and first and last shift. I just didn't want to go back there.
And the CEO of a Melbourne-based security company, Brian Goods-Bloom, says he would not use subcontractors for this kind of work.
I think that ultimately this is going to be really difficult to get to the bottom of, because who are the subcontractors, how many were there, and then how many people did they supply? And I would suggest if you're looking at the WhatsApp sort of system, if that's their proof of delivery, then there's going to be a lot of questions asked. The moment you start subcontracting is when you start losing control. So I'm not surprised that the hotel quarantine situations occurred, given that a number of these situations and practices have occurred for many, many years.
Yeah, so that's part of that 7:30 report last night on the 7:30 program, and you can catch that full episode on iView if you want to have a look at it. And we're going to talk to a research expert in this field in the next hour or so. In New South Wales, health authorities are urging people in the Port Stephens area, that's just north of Newcastle, to get tested if they develop flu-like symptoms, with a new COVID-19 case confirmed in the region. Reporter Madeline Lewis joins us now from East Maitland. Madeline, g'day. So what's happening at the hotel today?
Good morning, Joe. Look, I'm here at East Maitland. It's about 30 minutes northwest of Newcastle. I'm out the front of the Windsor Castle Hotel, which is closed today for a precautionary deep clean. All staff are being COVID tested. Now, that's because publican Nicholas Quinn late yesterday was told that a Sydney visitor was in his establishment last Monday night and had coronavirus. So a very concerning message that he received just yesterday, late afternoon. He made the decision. It wasn't a directive from the health department. He wanted to close the venue, give it a good clean, make sure it was safe, make sure it was clean for everybody to come back. He's hoping to reopen tomorrow, but a lot of precautionary measures in place. There's a group of cleaners that arrived here very early this morning, all suited up, ready to make sure that this venue is safe to reopen again tomorrow.
Well, look, we remain concerned. We remain on high alert. But the one positive takeout for us is that yesterday it was confirmed that all the clusters we have in New South Wales at the moment do have the same genomic sequencing, which means at this stage we've not found anything which is a new situation, a new cluster. It's all from the same source, the same genomic sequencing. So that gives us a degree of comfort. But of course, our state remains on high alert. And I've been saying to our citizens, be extra cautious. Don't move around unless you have to. Be careful about what you're intending to do over the weekend. Avoid large crowds. And these are just sensible bits of advice to give people, in addition to the additional restrictions we've put in place, which come into effect on Friday as well, in relation to hospitality venues.
Gladys Berejiklian speaking there about the broad challenges in New South Wales now, because there are so many different places around the state, particularly in Sydney and to the north of it, that have had possible coronavirus cases at them. And I might just tell our viewers now, if you are concerned you're in one of these spots and you're not really sure what to do, or you're not sure if the venue was a venue in question, go to the New South Wales Health website, and it's got a complete list there of the the venues possibly affected and what you should do if you were there. So it's pretty obvious to find on the New South Wales Health website. And so, Madeline, what's the latest advice from health officials?
Yeah, so I guess the concerning thing with this situation is that the man that was here at the Windsor Castle Hotel has then travelled to Port Stephens. It's about an hour away east from here. And a local man in his 60s then contracted coronavirus from this person. And one of them was at the Salamander Bay Shopping Centre last Wednesday on July 15. That centre has since had a real deep clean as well to make sure that it's safe for people. The advice earlier this week was for anyone in the Hunter New England region to not visit Sydney unless absolutely necessary. Avoid any unnecessary travel is the main message coming from our local health department. They're deploying more resources to COVID clinics, particularly to Tomaree Hospital in Port Stephens and also Maitland Hospital. Anyone that's showing signs of COVID-19 symptoms, even mild ones, such as fatigue, should be tested. Even if they have already been tested and received a negative result, they're being encouraged any sign of COVID to be tested again. And particularly if you were at the Windsor Castle Hotel here in East Maitland last Monday night between 6 and 8 p.m, or if you were at the Salamander Bay Shopping Centre last Wednesday, July 15.
Okay, Madeline Lewis reporting there from East Maitland, just north of Newcastle. And tighter restrictions along the New South Wales-Victoria border have come into effect this morning. Reporter Ashley Aldridge joins us now from the Albury side of the New South Wales-Victoria border. Ashley, g'day. And first of all, thanks for standing out there in the cold on the border. It feels like you've been standing there for about a week or so. I think on the first day it seemed like it was freezing, but not too bad today.
Yeah, look, I promise I'm not sleeping here. I am a Victorian resident, so I am going back home at night, not staying in New South Wales. But as you mentioned, those new restrictions came into effect at midnight last night, and we've been down here since about 5 o'clock this morning. From about 6 a.m, that heavy traffic really started to flow through this checkpoint. Now, this is one of the main two crossings between Wodonga and Albury. And as you mentioned, I've been coming down here for the past 2 weeks, and I have to say that this is the worst that I have seen it during this time so far.
Yeah.
So police were anticipating this though.
Yeah, and so they've prepared for it?
Yeah, look, they've got the 2 lanes open and they're bringing the cars in about groups of 12. Once the cars do get to the checkpoint, the process only takes about 40 seconds. They're getting their permits checked and they're moving on. We have just heard, though, we understand that the traffic going back into Victoria is actually banked all the way back into Wodonga and is now in the main street of Wodonga, High Street. So people looking to come across into Albury this morning do really have a long commute. A Twitter follower just sent me a message with a picture and it's just bumper to bumper, and they suggested that they should have packed some snacks in their car this morning for their long commute to work.
And Ashley, what have locals been telling you about this process and how it's been handled? Are they accepting that this is just what has to be done in a time of this pandemic, or are they saying it could have been handled more effectively?
I think when the initial closures were put in place, locals were quite accepting and they understood that it needed to happen. But these tighter restrictions have not been received well, it's fair to say. Just to give a bit of perspective, I spoke with an Albury business owner that actually lives in Killara, which is a suburb on the other side of Wodonga in Victoria. Now, that's about 10 kilometres from where I'm standing at the moment, but they now fall out of that new border zone bubble, which is just a 2-kilometre radius. So at the moment, they are not able to leave their home to go and open their business in New South Wales because they can't obtain a local resident permit. So you can understand that there is quite a feeling of frustration here on the border this morning.
Yeah. And is the essential change from now that you can't just go for shopping? Is that the essential difference now?
There is that, but it's also the prior to last night, the radius to be considered a local resident was around 50 kilometres. Now, that's been reduced to 2 kilometres for towns along the Murray River. So we're hearing of suburbs that are literally split into 2. So we spoke with a man that he isn't eligible to get a permit, but the house a few doors down can. So it's making life very difficult. I think the slogan here is 2 cities, 1 community, but that's just not the case at the moment. People aren't able to cross across the border to get to work. And even for health reasons at the moment, if you can get those health services or medical supplies in Victoria, then you don't qualify for a permit.
Yeah, and actually just that fog seems to be rolling in. Is the fog pretty heavy on the Murray this morning?
It is. It's fair to say it's freezing. I can see the police have actually set up a fire pit across the road. So it's the first time I've seen that here. So it's pretty cold, about 1 degree this morning. So It's a chilly one.
Okay, Ashley Aldridge reporting there from Albury. Now, Queensland Police are working to find 185 people who they believe gave false contact details to avoid self-quarantine. It comes as police issued a $4,000 fine to one man who they caught trying to sneak through a border crossing in the boot of a car. 2 women in the car were also refused entry. The Federal Treasurer has warned there'll be eye-watering figures in tomorrow's economic update as the government grapples with the coronavirus pandemic. It comes after the fate of the Job Keeper and Job Seeker programs were unveiled yesterday. Political reporter Jade McMillan joins us now from Canberra. Jade, g'day. Just take us through this series of economic announcements that we've had this week and so how they differ from what we're likely to hear tomorrow.
Well, the government insists tomorrow won't be a mini budget. It says the announcements about JobKeeper and Job Seeker have already been made, and tomorrow will be more about updating the key economic forecasts and providing a clearer picture about just how badly the budget has been affected by COVID-19. Now, among those economic indicators that we're expecting to receive more information about tomorrow will be the government's predictions on the unemployment rate. We know that it's sitting officially at 7.4% at the moment, but the Prime Minister and Treasurer have been increasingly speaking about what they call the effective unemployment rate, which also takes into account people who've left the workforce altogether or who are still employed but aren't actually working any hours at the moment. For example, if they're being supported by the JobKeeper wage subsidy, and that rate is around 11.3%. So we should get more information tomorrow about where the government sees that rate heading. The Treasurer, Josh Frydenberg, argues that the federal government is doing everything it can to try to support businesses and communities through coronavirus, but he says that the states and territories, especially those that have been affected by these latest outbreaks, also need to do more.
Let's not forget, every dollar we spend today is borrowed money. The Commonwealth is increasing its debt very substantially, and you'll see those eye-watering numbers tomorrow. We're increasing that debt very substantially because the public needs it. The Commonwealth needs the states as well to be side by side. Now, Victoria's already made some announcements, and we welcome that, but any more that they can provide to those in need, including those without a job, is of course welcome.
And Jade, yesterday the government announced the planned changes to the wage subsidy program called JobKeeper and the increase to the unemployment benefit called Job Seeker. What's been the general reaction to those changes?
Well, we learned yesterday that both JobKeeper and the Job Seeker supplement will continue beyond September, although at lower rates. JobKeeper will go through until March next year. Post-September, it will be a 2-tiered system, depending on the number of hours worked, while the Job Seeker supplement will be paid at a lower rate from the end of September till the end of the year. The federal opposition is broadly supportive of those changes announced by the government yesterday, but it wants it to commit to a higher base level for the Job Seeker payments so that people receiving Job Seeker never go back to the old rate, it used to be known as New Start, of around $40 a day.
Labor is very inclined to support what the government has suggested yesterday, but we will continue to argue very strongly that there needs to be a permanent increase into what is now the Job Seeker package. We have heard that the old New Start rate, which was $550 a fortnight, was just throwing people into poverty. There was absolutely no way it was an incentive to work.
Shadow Social Services Minister Linda Burney there. Now, the Prime Minister has suggested that even beyond the end of the year, when that job seeker supplement is now due to finish, that there will be some extra support provided to people on job seeker. Labor arguing there, though, that those people need more certainty now.
Okay, Jade McMillan reporting there from Canberra. Now, the US has been one of the worst hit countries in the world through this coronavirus pandemic. I think the death toll in the US is up now around 140,000 people. US President Donald Trump has resumed regular coronavirus press briefings today after he stopped them back in April, and back then he said they were a waste of time. North America correspondent Catherine Diss joins us now from Washington. Catherine, g'day. So what's the President had to say? Yeah, well, how long did this media conference last? Because they were notoriously long when he was doing them before. And what's he actually had to say?
Yeah, good morning, Joe. Look, you're right. At some points in time, I think we were sitting there watching him for about 2 hours. But today he was far more restrained. He didn't go on rambling different, speak about rambling different things. He stuck to message today. I think, had probably been advised to make sure he did that. He spoke about a range of different things where he expressed grief for the lives that had been lost. He said that they would not be in vain and that they would make sure that the country vindicated that by making sure they developed a vaccine and continue to find new drug treatments for coronavirus patients. He also, interestingly, urged all Americans to wear masks, which, as you know, has become a highly partisan issue here, where the President for the first time himself wore a mask publicly only earlier this month. But I think the most interesting thing, Joe, was his tone. He was far more pessimistic than what we've seen in recent months. As you mentioned, he canned these daily press briefings back in late April after that fairly embarrassing moment where he suggested that disinfectant could be injected into patients or that ultraviolet light could be used to treat coronavirus patients. He then decided to stop doing that, and since then he has really pivoted towards focusing on the economy and reopening America. But today we saw a vastly different president. As I mentioned, he was somber, he was deflated, and he acknowledged something that he doesn't like to do, and that is that things are likely to get worse before they get better. Let's take a listen to what he had to say.
The China virus is a vicious and dangerous illness, but we've learned a great deal about it and who it targets. We are in the process of developing a strategy that's going to be very, very powerful. We've developed them as we go along. Some areas of our country are doing very well, others are doing less well. It will probably, unfortunately, get worse before it gets better. Something I don't like saying about things, but that's the way it is.
And Catherine, so why has Donald Trump decided to restart these briefings now?
Well, look, I think that, Joe, that the problem just became too big to ignore. As I mentioned, he wanted to focus on the economy, but with cases surging right across the country, particularly in the South, in states like Florida, Texas, Arizona and California, they're crushing case counts on almost a daily basis, and the death tolls in those states are now starting to rise. So I don't think he could ignore the problem any longer. He started to get bad polling numbers. The number of Americans who now disapprove of his coronavirus handling or handling of the coronavirus pandemic has started to grow. Recent polling say some 60% of Americans disapprove from the way in which he's handled the crisis. So as he heads closer towards that poll in November, he's certainly trying to find as many ways as possible to change the tune, I suppose, Joe.
And were the health officials anywhere to be seen?
Look, no. And this, of course, was on the rumour mill for most of the day here in Washington, that he wouldn't appear beside his top health officials. He didn't. He appeared by himself. And a lot of the speculation here is that he wanted to do that to try and regain control of the news cycle here and to show that he's really the one in control of what's happening.
Okay, Catherine Diss there in Washington. Let's take a look now at the coronavirus figures in detail. ABC analyst Casey Briggs joins us. Casey, g'day. So what will we be looking for when the Victorian Premier steps up at some stage today?
And the New South Wales update both at 11 o'clock this morning, as has been the case for a few days now. So we'll bring you the details of that when we do get them. What we're looking for is to see this growth slowing down. As we just heard, the overall trend in Victoria is still going up. We're 14 days now since the stage 3 restrictions were imposed across the entire city, obviously closer to 3 weeks in 10 or a dozen or so postcodes. So you'd hope to be starting to see an impact. We are definitely seeing this growth is slower at the moment. It is looking more like linear growth than exponential growth, and that's much easier to contain than exponential growth. And so we're seeing that there is some downward pressure on the curve. That's a good thing. We want to see that continue, in short. The big question has been, why after 2 weeks of this have we not seen a better result than we have already? And we have been speculating as to why that could be, and it may just be that, you know, with much more community transmission, it just takes a bit longer than the first time around to snuff it out. It would be really handy if we knew more about where infections were, the kinds of environments they were in. We know that lots of it's happening through workplaces rather than families and sort of social groups and things like that. But there's also a lot we don't know. The number of, just to give you an idea of the number of the backlog that Victoria's public health team are currently dealing with. This is the number of cases under investigation in Victoria over time. And it was kept at a very, 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 very low number for a very long time. Just in the past couple of weeks, it has exploded. There are now almost 1,900 cases under investigation. That's an investigation into where the infection was acquired. So that means 1,900 cases. I think that's more than half of Victoria's active cases. We just don't know where they came from. And that makes any sort of analysis very difficult. And I'm sure it's making the life of the Victorian government difficult as they try and chart a path through this. We just don't know what's going on. Contact tracers clearly have now just been overwhelmed.
Yeah, and in amongst those figures yesterday, a really concerning jump in the number of people affected in aged care facilities. Take us through those numbers.
Yeah, one home in particular yesterday, St Basil's Home for the Aged in Fawkner, almost quadrupled its total number of infections yesterday, from 13 up to 51 in a single day. The spread through aged care at the moment is extremely quick. Let me show you this chart. This is the total number of infections in residents of residential aged care homes across the entire country, going back to the start of the month. There are currently 3.5 times more infected aged care residents as of today than there were on July 1. 71 back then, 251. 180 have been infected in the last few weeks. That could be disastrous. What was the fatality rate of those that were infected before July? More than 40%. We're looking at a very, very grim situation in aged care homes across Victoria at the moment.
And the number of locations in New South Wales where people have to check if they've been there and then what they should do if they were there is growing. But does it appear that New South Wales is kind of effectively on top of things at the moment if those numbers aren't rising? Yesterday the number of new cases was 13 and they knew exactly where each of those cases had come from.
Yeah, I think it's a bit hard to tell. Sydney and broader New South Wales are still playing this game of coronavirus whack-a-mole. The challenge for New South Wales is to catch all of those moles before they reach any of the highest risk environments. That list, no moles popped their head up yesterday, no new locations were of concern, except actually I should clarify, one actually new one in the afternoon in the Port Stephens area was a potential threat where we saw a public health alert issued. So that hopefully we'll get some more detail about what's going on in the Hunter region later today. But that list has not grown too quickly lately. My big concern, though, still is that we saw a number of events, particularly this Our Lady of Lebanon Cathedral, where we've got 3 masses and a funeral. I don't think we've seen a full incubation period since those events. If we've seen significant transmission there, well, we wouldn't yet be seeing it. The other issue is testing has caught known chains of transmission. If there are unknown chains of transmission, well, we certainly wouldn't have seen those yet because they haven't yet reared their head. And so I don't think Sydney's yet in a position where it can rest easy. It's nice to see that the list of locations being with potential exposure is not growing very quickly at the moment. I worry this could be just a lull.
Yeah, and Casey, just before we leave you, we missed a couple of your seconds at the top of your cross there. Were you saying that Victoria is confirmed for 11?
I believe so. I think it's 11 and 11 also for New South Wales. That's been the pattern for the last few days, but we'll wait and see.
Yeah. Okay, Casey Briggs there.